Wonderful. Welcome everybody to our seminar on falls and fall prevention with Dr. Kimberly Bell. We have a ton of really terrific seminars lined up for you. I hope everybody is checking RA RSVP regularly and signing up there for everything we've got in store for you. I will mention that we've got another great one lined up for tomorrow, Your Taxes in 2021. Really good seminar set for 12 o'clock tomorrow. And next Wednesday, we have Medicare and UCSD healthcare plans. For those of you who participated in the Medicare 101 seminar, that was an introduction to Medicare, and this one drills down to how Medicare interacts with your UCSD healthcare plans. So that's next Wednesday, followed by Thursday, our estate planning seminar with Heidi Klippel. I noticed that we have a number of staff members on our call today. I'm very pleased to see that. Welcome to those of you who may not yet be members. You need to know that membership in the UCSD Retirement Association is open to current staff and faculty, as well as to retired staff and faculty. And we highly recommend that if you are 1, 2, or 3 years away from retirement, it's really a great idea to become a member now, because it's kind of like dipping your toe in the pool, seeing all the resources that are out there and starting to prepare for your retirement in an intelligent fashion. You can go to our website. Anthony, go ahead and plug that into the chat for me, retirement.ucsd.edu. And there's a membership tab there, real simple. You can download the membership brochure and mail that over to us. It's only $30 a year, and we would love to have you join us. So today we are here to talk about falls and fall prevention. And boy, have we got an expert for you. Dr. Kimberly Bell is a DPT, Doctor of Physical Therapy, who specializes in dizziness and vertigo treatment in San Diego County and surrounding areas. Her mission is to rescue people suffering with dizziness, vertigo, balance problems, and falls. Her UCSD Stein Institute on Aging lectures have garnered more than 500,000 views on YouTube. As a doctor of physical therapy since 2002, Dr. Bell has specialized in learning how to assess the root causes and resolve dizziness, vertigo, balance problems, and falls. She opened her specialty physical therapy practice in 2014 to rescue misunderstood and mismanaged people who suffer from dizziness, vertigo, balance problems, and falls. Please join me in welcoming Dr. Kimberly Bell. Kim, take it away.
Thank you so much, Susan. I really appreciate that great introduction. And I have some exciting news. One of the UCSD Stein public lectures that is from about 3 years ago just passed 1.1 million views on YouTube. So
wow.
It's really helping a lot of people from around the world who are suffering with dizziness and vertigo. And then I do have another lecture on UCTV on preventing falls and a second one on dizziness and vertigo. So those are all, I'll give you more information towards the end of this talk about that. So let me go ahead and share my screen. Anthony, can I share my screen now?
Yes, you are co-host.
Okay, good. Okay, let me just change my settings to allow Zoom to view my screen. Okay, let's see if this wants to work now. Great, okay. All right, Susan, can you see my screen?
Yes, I can, you bet.
All right, wonderful. So the topic for today is preventing falls with helpful tips. And we are offering this lecture twice a year. So I'm glad that you're able to join me today, and we will be recording this if you want to go back in the future and review anything that we talked about. Of course, you're also welcome to contact me individually if you have questions later about this topic that we didn't cover today. So I want to introduce you all to an effort by the San Diego County Health and Human Services Agency. They have the Aging and Independent Services team, which is the health promotion unit for older adults. And we have a fall prevention task force. So how many of you have heard of the San Diego Fall Prevention Task Force? Just kind of reflect if you've heard of that or not. We've been around for well over 15 years now. We are a group of professionals, both public health providers, which work for the County of San Diego, and then private healthcare providers that work at all the different hospital systems and healthcare locations around San Diego County. And we all share a common mission, which is to reduce falls and their devastating consequences for older adults in San Diego County. If you want to learn more about this group, this task force, you can check out san diego fall prevention.org, which is hosted by the San Diego County Aging and Independent Services, and they have resources and information on there. And you can see our logo on the screen. I was the co-chair of this group for a total of 8 years over the last 15 years, and I continue to be a clinical leader of the group as other people are taking over chairing the task force. So I'm speaking to you today both as a clinician, as she described. I'm a doctor of physical therapy with a specialty in this area, but I'm also going to share some about the public health side of things because this is a concern both for private healthcare providers and public health. So we're going to start off with some myths, some common myths related to falls. And these are things you may just hear people say in passing. You may hear it from your neighbor or even maybe from your healthcare provider. And so we're gonna explore some common myths about falls in older adults. The first common myth is that muscle flexibility and strength cannot be regained. And it is true that with normal aging, muscles lose mass and they lose strength through normal aging. However, through exercise like strengthening and stretching, flexibility and strength can be regained. The difference here is that someone who may never have had to exercise ever before in their life and was able to stay strong through their normal activities, hobbies, and maybe an active lifestyle, with work, if they had a job where they were working a lot, say like a landscaper or somebody that had a physical occupation, maybe they never had to exercise before specifically, but now as we're getting older, we see that people do need to exercise to maintain muscle strength and flexibility or to regain it if they've lost it. The second myth is that as long as I stay home, I can avoid falling. That's a common thing you'll hear if someone starts to have falls. Their children may say, well, just stay home, just give up the golf, just give up your activities, stop driving, stay home, and then you won't fall. However, this is a myth because most falls actually happen on level surfaces by slipping or tripping in one's own home. And so therefore, staying home does not necessarily prevent falling, because most people fall in their own home. However, interventions that we're going to talk about today can reduce the risk of falling. The third myth that we're going to look at is falling is a normal part of aging. And this is not true. While it is true that people who are older fall more often than younger folks, it's not true that it's an inevitable and normal part of aging. Very frequently, there's an underlying cause of the falls that can be addressed to reduce the risk factors. And so at this point, we have about 1 out of every 4 people over 65 is reporting a fall once a year. So here we go for the statistics. I already gave you a preview of this. About 1 out of every 4 older adults are reporting a fall every year. Now, this statistic is not necessarily that they're telling their doctor. This is from a health information survey where surveyors called people and interviewed them over the phone about their health. So it's even fewer than this who are actually reporting to their doctor that they have fallen, because a lot of people fall and they never tell anybody. They keep it a secret. They don't tell their doctor. They never end up in the hospital, especially if they're not injured. They just kind of try to brush it off, minimize it, and they never report it. So this is actually the number of people who reported falling on a health survey, not necessarily who's telling their doctor that they're falling. However, we don't want people to hide the fact that they're falling, because if you've had one fall, it actually indicates a higher risk of falling again. In fact, the statistics are that 50% of people who fall will fall again within 6 months. Now, the good news on that is that 50% of people who fall will not fall again within 6 months. And I would suspect that the 50% who are not falling again within 6 months are the ones that are telling someone and doing something about it. So that's the key. The very first fall needs to be a wake-up call for an intervention. And we're going to talk about what some of those interventions are today. Now, can we prevent people from falling 100%? Of course not. There may be something where you trip on a dog or you trip on a curb, or, you know, something happens and you fall. There's no way we can say, absolutely, we can prevent people from falling all the time. But what we do say is we want to reduce the likelihood or the risk that someone's going to fall by intervening on specific risk factors that we know increases the likelihood that someone will fall. And we also want to talk here about what defines a fall. So a fall is defined as an unintentional landing on a lower level. And that could be the floor, or that could be a bed or a chair. If you happen to be near a bed or a chair and you fall and you land on the bed, but it was unintentional, that still counts as a fall because you lost control. And if the bed or the chair had not been there, you would have ended up on the floor. So it's an unintentional landing on a lower level, whether it's a bed, a chair, or the floor. That's still defined as a fall, and that would still be worth doing something about. So we're going to break the interventions that you can do into 4 major categories that we're going to cover today. So there's 4 major actions you can do to prevent falls or really reduce the risk of falls. And those are speak up, keep moving, check your eyes, and make your home safer. Now we're going to go through each one of these categories individually with specific helpful tips. The first one is regarding speaking up to your doctors and your healthcare providers. The problem we face regarding falls is that people with chronic health conditions sometimes are at a higher risk of falling. And then there's certain medications that can cause falls as well. So for example, just think for a moment, if you can think of a chronic health condition that may increase the risk of falling. I'll just give you a chance to think about that. And now I'll name you a few. For example, arthritis. If someone has pain in their knees or pain in their back and they're limping a little bit because they're in pain from arthritis, that can put them at a higher risk of falling. Another condition, for example, is foot neuropathy. So people with numbness, tingling, or pins and needles in their feet that don't feel their feet completely, that puts them at a higher risk of falls. Other chronic conditions are examples like cardiac conditions that make you dizzy, like irregular heart rate that makes you feel dizzy, or blood pressure that's too high, blood pressure that's too low, blood sugar drops if you have diabetes, and things like that. So those are just some examples of chronic health conditions that can contribute to fall risk. Now, let me ask you to think if you know of any medications that can contribute to fall risk. So just think about that for a moment as well. So some examples of medications that can contribute to the fall risk are any medication that has a side effect of dizziness, drowsiness, blurry vision, muscle weakness, and things like that. So a lot of medications have a side effect of dizziness. That's one of the most common medication side effects that we know of. So therefore, even just taking one medication can increase the risk of falls if the side effect is dizziness or blurry vision. And so therefore, to manage these chronic conditions in the best way possible to prevent falls, and also to make sure that your medications are being supervised, we want to make sure that you speak up when you're meeting with your healthcare providers. It's really important that somebody knows every medication that you're on. What we see often is people are getting medications prescribed from all different doctors, maybe your cardiologist, your neurologist, your primary doctor, maybe even your ophthalmologist is giving you eye drops, or you have a skin cream from a dermatologist. And then maybe your daughter or your son is telling you you should take all these supplements. And so you're getting guidance from a lot of people. And it's really important for one provider to know everything you're taking so they can check for drug interactions and medication side effects that may indicate that you need to have a different prescription, or your dosage may need to be adjusted if you're having some side effects from a specific medication. Sometimes the doctor will change the medication or change the dosage, or maybe just change the time of day. Maybe you take it in the evening or instead of the morning. And that all needs to be decided by a medical doctor, which would be your physician. It's usually your primary care doctor, your physician assistant, or your nurse practitioner, whoever's doing your general care, your primary care, your GP. And so it's important to keep an updated list of all the medications and supplements you're taking. If anyone changes your medications, you have to update the list to make sure it's current. And then you can ask your doctor to check it for side effects and drug interactions. Now, the other option is sometimes they call it a brown bag medication check, where you put all your med bottles in a bag and take it to a pharmacy, and you make an appointment to meet with the pharmacist to look at all your medications, go over side effects, and look for drug interactions. Some pharmacies offer that. And so it would either be a pharmacist or a primary care provider that would need to check your medications. Also, if you happen to lose more than 10% of your body weight, so say you weigh 200 pounds, if you lose 20 pounds, your doctor will need to know, because you may need your medication dosages adjusted based on your new body weight. Sometimes medications are prescribed based on body weight. And so if you have lost significant amount of weight, whether intentional or unintentional, you need to let your doctor know to make sure your medications are still correct for you. Here are some other things you can speak up and talk to your doctor about. You can ask if any of your medications may be contributing to the risk of falling. Take all of your medications and supplements to review. That's what we just talked about. Ask about possible side effects and any combinations of medications that may be affecting your risk of falling. You can talk to your doctor or your general practitioner about if any of your other health conditions are contributing to your risk of falling. Maybe you have a neurological issue, a visual issue, cardiac, or even mental health. Even depression has been shown to increase the risk of falling. Maybe your doctor wants to refer you to specialty providers. Like maybe you want to consult with another provider that specializes in this type of a health condition to reduce your risk of falling by managing your health condition more proactively and making sure you're not just ignoring it. Now, a lot of times the doctors and healthcare providers won't have a lot of time on the visit. So you want to go in with questions ready, and maybe bring someone with you that can help you take notes on the visit so you can remember what your doctor told you, because sometimes it happens so fast, they leave the room and you go, I don't know what they just said. So if you can bring someone with you to help you advocate and keep track of what they're telling you, that would be great. Well, I'm going to share with you another resource we have in San Diego County towards the end to help you manage chronic health conditions that can contribute to falls. The third thing on this list here would be to ask your general practitioner if you may benefit from receiving a referral to physical therapy or occupational therapy, or maybe vision therapy even. So these are different types of rehabilitative services or rehab services that can improve your function, your day-to-day function. So the vision therapy would be like if you feel dizzy when you're working on the computer, for example, maybe you need vision therapy, you need some eye exercises. The physical therapy would be if you're having trouble getting up and walking around, getting out of bed, things like that. And the occupational therapy would be if you're having trouble with like doing your showering or toileting, and getting dressed and preparing meals and things like that. So whatever things you may be struggling with, your doctor can possibly refer you to a therapist to work on that and restore that function or improve that function, or set up equipment and strategies to help you if you can't restore the function that you had before. You can also ask your doctor if you should be taking specific supplements. For example, if your iron or your B12 is too low, then you may have dizziness, for example, that could put you at risk of falling. We see this particularly in people that are vegan, following the vegan diet. They usually have to supplement iron and B12, which are commonly low in that population, so they don't have anemia, which can cause dizziness and contribute to falls. So your doctor will do, like when you go in for your annual wellness visit with your doctor, they'll do a basic panel of blood work, and they should check you for vitamin deficiencies to see if you're low in calcium, vitamin D, B12, and iron, things like that. And your doctor will know exactly what to do. And then you can say, do I need to take any nutritional supplements? Vitamin D being another common one that people will often need. So that should be decided and prescribed by your general practitioner. And then the other question you can ask your doctor when you're speaking up is, you can say, what type of exercise should I be doing? You know, I know that normal aging can reduce the strength of my muscles and I can lose muscle mass from normal aging. So I know I need to get moving. I need to be active. What exercise can I do to increase my strength, my balance, my flexibility, and my bone mass? And then if your doctor has a suggestion, that's great. And if they're not sure, I'll give you another idea in a few minutes of what you can ask for. Well, really what you would ask for is a referral to physical therapy from the doctor, because physical therapists we specialize in training and prescribing exercise for people who have medical and surgical histories that make them uncertain how to exercise properly on their own. We'll talk more about physical therapy in a little bit. So the doctor usually will do, at your annual wellness visit, they'll usually do a basic fall risk assessment. This is actually required now by most insurance companies for people over 65 to be asked these questions during their annual physical or their annual wellness visit. The questions are, have you fallen in the past year? And again, I would encourage you to be honest and include, even if you fell and you landed on your bed, or you fell and you landed on a chair, include that. And then they'll ask you if you feel unsteady when you're walking or standing, and if you worry about falling. The reason for this is because we know these three things, if you say yes to any of these things, that actually puts you at a higher risk of falling compared to other people your age who do not say yes to these things. So anyone who's fallen in the last year is at a higher risk of future falls. Anyone who's unsteady standing and walking is at a higher risk of falls. And anyone who has what's called fear of falling, if they're worried about falling, then that actually increases their risk of falls. We have research that proves that people who have a fear of falling actually change the way they walk in a measurable and specific way because of the fear, and that increases their risk of falls. So it's not to say that you have to fix this all on your own, but it's to say that if you have a yes to any of these questions, that would be a good reason to get a referral for physical therapy so you can work on your walking, your balance, and your steadiness. So the next problem that we see is physical inactivity and fear of falling. And I kind of hinted at the fear of falling on the last slide. So again, fear of falling, what it actually causes people to do, if you can picture in your mind somebody walking the plank, you know, on the edge of a pirate ship or something in a movie, what are they doing? They're taking really short steps and they're tipping right, left, right, left, right, left. Okay, so that's the predictable changes we know through research happen when people are afraid of falling, is they look like they're walking the plank in a pirate movie. They literally take smaller steps, so their step length is shorter, and they are more likely to tip over to the side. They're more likely to fall over to the right or fall over to the left when they're walking, when they're afraid of falling. So fear of falling is something that requires intervention, and usually physical therapy referral is going to be what's most helpful for that. Now, physical inactivity, that's something we should talk about, because a lot of people think when they retire, they're just gonna relax. I think a lot of people equate those two words, relaxation and retirement. They think that's the same thing. And I'm here to tell you, and I've said this before, and I'm sure I'll say it again. If you are retired, you still have to have a schedule of physical fitness activities, physical activities. So you may not work anymore, but you need physical activity on your schedule, whether that's gardening or cleaning your house or exercising, going for a swim, a class, whatever it is, you've got to stay active. Because if you have what's called a sedentary lifestyle, which means you just sit around all day, relax, read the newspaper, watch TV, talk on the phone, things like that, your muscles are literally going to get weaker and weaker over time due to normal aging. So you have to make your schedule in retirement around your activities, and then don't compromise. So don't cancel your exercise class because somebody else needs you to do something. You tell them, listen, I'm as serious about my exercise program as I was about work. I can't miss it. I have to do it. We're going to have to schedule around it. And that's the key, because if you don't make your schedule around your fitness and your activity, you're going to end up having to make it around doctor's appointments. And so I don't want that for you. If you can be proactive in your staying moving, you can stay strong and hopefully stay balanced and keep going. Now, if you feel scared to move, this fear of falling, then you definitely want to do some kind of physical therapy intervention for that, to address the problem and then figure out what's safe to get going with the guidance and supervision of a professional. So when you're getting moving, another thing that's really important is proper footwear. This is actually something that's fairly easy to modify to reduce your risk of falling. So let's take a look at these 3 footwear choices. We've got the ladies, we got the heels for the ladies. What do you think about that? Give me a thumbs up or a thumbs down. What do you think? Good or not good to prevent falls? I see a couple people shaking their head. No, that's right. So the problem with the heels, ladies, is that you can twist your ankle really easily. I've met a number of people who were dressed up to go to the theater or go to the opera, and they twisted their ankle, they rolled their ankle, and they fell right down on the ground. So unfortunately, we don't want the heels. We want a thin, non-skid sole. We've got to get rid of the heels. Maybe you can donate them or give them to your children or grandchildren. We got to get rid of the heels. And then that also, by the way, goes with men's dressy footwear. So a lot of times when men get dressed up, they wear shoes that have a slick bottom. So their men's dress shoes tend to be slippery on the bottom. So that's another thing to look out for the gentlemen. Make sure you don't wear dress shoes for a special occasion that are slick on the bottom. You need to have some kind of a grip on the bottom so you don't slip. And then let's look at the second option here. This has got an X over it, so you already kind of know it's not ideal. But let me explain why. It's too thick. The sole is too thick, and it looks too heavy. It's too clunky, okay? These are not great shoes for preventing falls because the sole is too thick and it's too clunky. So we want to look all the way to the far side of the screen here, where this person is putting on a pair of shoes. These shoes look great. Why? Because the sole is thin, it's non-skid, it's securely fastening to the foot. It's not like a flip-flop. The sole is not too thick, and there's no high heel or anything. So this looks like an ideal pair of shoes to prevent falls. Like regular sneakers are great to prevent falls because they fit to your foot. They're non-skid and the sole is not too thick. So just regular sneakers or shoes like this would be great. And then if you need to walk around in socks around your house, make sure you get those socks with the grips on the bottom, like the hospital socks. You can order those or buy those at a store. If you haven't been to the hospital recently, you can buy them yourself, and just make sure that you're not walking around in regular socks, because they can be very slippery as well. So we want to wear socks with grips on the bottom if we have to wear socks around the house. So here's the solution to the physical inactivity and the fear of falling. You got to get your proper footwear. And see, these people all have on good footwear choices. If you look at the folks that are jogging down the street, they all have on shoes, the sneakers, those are great footwear choices. And even this woman in her wheelchair, look at the kind of shoes she has on. Those are a great choice as well. So they have the proper footwear in place, and then they're doing something active. So what's the right level of activity for you? Well, I don't know, because I haven't met you and I haven't assessed you, and I don't know what you're capable of. But I would say one of the most important things about being active is doing something you enjoy. So what we've learned is if you actually enjoy the type of exercise you're doing, you're more likely to do it. So for example, dancing is a great one. You could do an online Zumba class. You could do, they even have some chair dancing. You can sit in a chair and watch a video online and do dancing. This lady's doing gardening, sitting in a chair. You could do, if you're able to get up and go out, you could go for a walk or go for a bike ride if that's safe for you. And we have some other options I'm going to share with you for fitness in San Diego as we go along. So if you're not sure how to exercise because you have a heart condition, or you've had a stroke, or you've had surgery on your knee and you don't know what's appropriate, or you have pain, or you get short of breath, or something like that, something that makes you scared, you don't know how to exercise properly given your health condition, that's when you ask your doctor for a referral to physical therapy. Now, I'm a physical therapist, so I want to make sure you understand what we do. We are the people who improve the way you move, whatever it is. So if you need help figuring out how to get out of bed, you need help figuring out how to climb the stairs, get in and out of the car, walk up a hill, walk on a level surface, whatever you need to do for movement, that's what we specialize in helping people do, either by strengthening, by training, or by special equipment. Like you see, this lady has a walker. That's a device we may suggest for people to help them with their walking if they need it, even if it's just temporary. So physical therapists improve the way you move. If you want to use your health insurance to pay for your physical therapy, then your doctor will need to make a referral through your health insurance, and they will need to find a physical therapist who takes your health insurance in order to get that paid for. California also allows what's called direct access to physical therapy, which is what most of my patients do, where I don't take insurance. So I just do cash, check, or credit card payment for my services, and I make house calls. So my patients just call me. They arrange for me privately to be their physical therapist through direct access to physical therapy. I don't actually need a doctor's referral since I'm not going to bill their insurance. And I just go to their house, I provide them with their care, and they just pay me at the time of the service. So if you find a physical therapist that does cash-based services, there's actually a lot of them out there now. You can just go right to them through direct access. You don't need a referral. But if you want to use your insurance, then you need a referral from your doctor to the physical therapist to get it approved and paid by the insurance. I want to mention that there is a way that you can receive physical therapy in your home. So this is what I do, for example, with my patients. And then there are home health agencies that provide house calls under Medicare Part A. And then there are physical therapy groups that provide house calls under Medicare Part B. So there's different options with different levels of insurance coverage to receive care in your home. You can also go to a clinic, a physical therapy clinic out in the community. And most hospitals have a physical therapy department in the hospital that you can go to also from your home. So you could go from your house to the hospital to do physical therapy there. You could go from your house to a clinic to do physical therapy there, or someone can come to your house to do physical therapy. Now, of course, if you happen to be staying in a hospital, they usually always provide physical therapy to you while you stay there. Or if you're in a rehab center, of course, you'll be receiving physical therapy while you're staying there as part of your services. So I want to mention a specific type of physical therapy. This is what I am. And this you'll find there's probably about one, on average, one of these at each hospital system around San Diego on average. This is called vestibular physical therapy. So just think for a moment, have you ever heard the word vestibular? Does that sound familiar to you? Okay, well, vestibular is the fancy word for your inner ear. So if you kind of take your fingers and put them right next to your ear holes on your cheekbones, right in front of your ears. Okay, now relax your arms back down. In that cheekbone is your vestibular system, which is your inner ear balance system. The vestibular system tells you where you are in space. This is how we can walk when it's dim lighting, for example. If it's dim and we still are able to balance and walk without our vision, of course, that's not great for fall risk. That's a dangerous thing to do. But if you happen to do it and you notice, wow, I can, it's because of your vestibular system. Okay, your vestibular system is helping you to balance, for balance and walking, as an underlying sensory component of your balance. Now, when your vestibular system is getting out of the best shape through normal aging, fantastic, through normal aging, our vestibular system degenerates like everything else in our body, like our muscles, right? So what that causes is unsteadiness with walking, feelings of being off balance, fear of falling, dizziness, and vertigo. So that's what I specialize in, is treating people with those problems. And I actually treat people of any age, because even young people can have vestibular problems. Say if they've had an ear infection, or they've had a concussion, or they had a car accident. Young people can get inner ear problems from other things, but usually older people have them just from normal aging. So the reason I want to tell you that is because if you've gone to physical therapy already, and you did everything they said, and you did all your exercises, and you finished the program, but you still feel off balance, you still feel afraid of falling, you maybe even feel dizzy, or you're dizzy at night when you lie down, your next step is to go to a vestibular physical therapist, because they are specially trained to treat the inner ear. Okay, and that's something that is not a common skill within physical therapy. You have to go to someone who has this specialized training. So that would be your next step. This should be where you go first if you're having dizziness, okay, or vertigo. You should go to a vestibular physical therapist first. Your doctor can make the referral if you want to use your insurance. But if you've already gone to regular physical therapy for your balance or your walking, and you're not feeling any more steady, you're still feeling off, you're still afraid, next step would be to the vestibular physical therapist. And what they're going to do is they do a root cause analysis to figure out, why are you unsteady? Why are you falling? Why are you off balance? Okay. And in some cases, why are you dizzy? This is what I do for my private patients. Vestibular physical therapists are trained to do a root cause analysis. They're going to do hands-on testing with you that is actually more helpful to figure out what's going on than even diagnostic tests. So a lot of people have gotten MRIs, they've gotten hearing tests, they've gotten CT scans, and all that is really important to do if your doctor recommended it, to make sure nothing really serious is happening to you. But even so, you can have a normal scan of your brain and still have balance problems. And so in that case, the hands-on assessment of a vestibular physical therapist to actually do physical testing on you, like what this lady's doing, is actually superior to diagnostic testing through MRIs and things like that to figure out why you're off balance. Okay, so that's the important thing to know, is that even if all your other tests came back clear, that's cause for celebration. Be happy about that. But then we still can investigate further through the vestibular physical therapist doing a root cause analysis and a hands-on exam. So here's how you can find a vestibular provider, either a physical therapist or a doctor who knows how to assess the vestibular system. This is a nonprofit organization called Vestibular Disorders Association, and this website, vestibular.org. What you can do is you pull that up, then they have a provider directory. You click on that, and then you type in your zip code or your city and state, and then you hit search, and it'll pull up for you people who know how to assess and treat the inner ear, which again, a problem with that is common with older people that have balance problems and falls. So now we're going to move on. That was the keep moving section. We've talked about speaking up about chronic conditions and medications, working with your doctor. We've talked about keeping moving if you're inactive or if you're afraid of moving or if you're not sure how to move, some solutions and helpful tips there. Now we're going to move on to the next problem, which is people with visual problems. So we know there's three things that go on here. There is normal aging of the eyes, and then there is eye diseases like cataracts, macular degeneration, glaucoma, and diabetic retinopathy. And then there are glasses. These are all the three things at play here with regards to vision. So the eye diseases, which I just mentioned, there's four main ones. Those are most common in people over 65. So that's why it's important to get a regular eye checkup to make sure your eyes are healthy. And if you get diagnosed with one of those eye diseases, like cataracts being a really common one, then you need to work with your doctor to manage that. So you want to work with your doctor to manage your vision if you have an eye disease. Maybe you need to put drops in your eye or something like that, depending on what you're diagnosed with. Then we have glasses. You want to make sure to get your eyes checked at least once a year to make sure your glasses are correct, because your eyes are going to change over time. And so you want to make sure your lenses are the right ones for you, and then actually wear them so that your vision is corrected. Regarding the glasses, one thing I see that contributes to falls a lot is people who get bifocals, trifocals, and progressive lenses. They tend to trip on curbs, steps, and hills or ramps, because what happens is they look down through the lower part of the lens, which is a different magnification for reading, and then they can't tell, their depth perception is off. So they can't tell how far away the curb is, the step, the ramp, or the hill, the slope. So what you want to do with that is make sure you either grab the railing if you're at a steps and there's a railing to grab, hold on to that for steadiness, or you've got to make sure you look through the top part of the lens, which is for distance, and not the reading lens. So you would actually need to tilt your head downward, like chin tilting towards the chest, so that you're looking through the proper part of your bifocals, trifocals, or progressive lenses to tell how far away that curb is, and not looking through the reading lens. If you keep your head level and you just glance down at an angle at the curb, you're going to be looking through your reading lens and you're going to misstep. So that's really important. And then some people just can't tolerate those multifocal lenses. Some people just never adapt to bifocals, trifocals, or progressive lenses. I had a lady I worked with who had dizziness ever since she got a set of progressive lenses. She never got used to it. And we realized, you know what, this just isn't for you. You're going to have two separate pairs of glasses, one for distance and one for reading. And then as soon as she switched back to that, her dizziness went away. So that's related to vision. And then the third thing we have here is normal aging of the eyes. So normal aging of the eyes shows that everyone, regardless if they have an eye disease or not, is going to become more sensitive to glare, meaning you may need to install curtains in your house where you never had them before. And then people are going to need more light to read what they used to be able to read before with less light. So you may need to increase the number of lights you have around your house to make it easier to see, specifically walking to the bathroom at night. Maybe you used to be able to walk to the bathroom with no lights on. Now you need a night light, or you need a motion activated light or something like that. So you're not walking around in the dark at night. That's a time when a lot of people fall. And then also with normal aging of the eyes, we have a little bit of a change in what's called contrast sensitivity, meaning it's harder for you to tell if you have a set of, say you have a set of gray stairs in your house. it's hard to tell where the edge of the step is because everything's kind of like shades of gray. So for that, sometimes we'll put a little thin piece of reflective tape on the front edge of every step so you can see where the edge is, because your ability to pick out contrast is reduced from normal aging of the eye. So those are the three things we deal with regarding vision and falls: is the eye diseases, the bifocal, trifocal, and progressive lenses, and then the normal aging, which everyone experiences, which requires a change in lighting and maybe some more visual cues like the reflective tape on the front edge of a step, and then adding the night lights to reduce your risk of falling. The other thing is, if you go spend the night at someone else's house, you've got to pack your own nightlight in your overnight bag, because it's your responsibility to make sure you have a nightlight. They probably won't even realize you need one. And you just put your nightlight in your overnight toiletry case, and then you have it in there, you plug it in when you get yourself set up wherever you're spending the night. And that just becomes part of your normal routine anytime you spend the night away from the house. The fourth problem that we have regarding falls is the environment. Now, what we found is if we only intervene on the environment as a standalone intervention to reduce the risk of falls, it doesn't usually help, except in people with severe vision problems. So when people have severe vision problems, like they're legally blind or something, definitely changing their home environment to make it safe significantly can improve their or reduce their risk of falls. But for other people, changing the home environment does not stand alone as a significant intervention to reduce the risk of falling. However, it is effective to reduce the risk of falling in combination with the other things I already mentioned: speaking up with your doctor, staying physically active, and getting your eyes checked. So we want to intervene around the home, because like I mentioned about the lighting, maybe you need more lights than you ever needed before. Well, same thing is true with the other things in the house. You may have been able to tolerate certain things up till now, but once you get over a certain age, usually over 65, we need to look at making changes to the house to make it more safe for you so you can age in place. Okay, so here's some examples. The first one here, the dark room, that's one we already mentioned. Somebody might have been okay walking through this room kind of dark here with the chandelier, but maybe as you get older, this is no longer safe. You need better lighting in this room. Now we have the puddle on the floor. This is really important if you have, say you have someone that, waxes your floors. If you have someone waxing your floor, that's a hazard for falls. And then if you spill on the floor or you mop the floor and it's not dry, of course, that can cause a slip and fall accident. The other thing I see is people who can't make it to the toilet in time. If they stand up and urinate by accident on the floor, that also increases the risk of falling. So part of what I do with my patients is bladder retraining to make sure they're not having accidents causing slip and falls on the floor. So with this, we want to make sure the floor is dry and not too slick with wax or anything like that. This next one shows a lot of clutter. This person may need to just organize, put some things away, put some things in a closet, or get rid of things. So a lot of times what'll happen is you've just kind of, put stuff in your house over time and you haven't had time to sort through and throw out things that are old or expired or you're not using anymore. So this person needs to declutter so that they can walk around their house without having to shimmy sideways in between things. So we need to keep the walkways clear, make sure there's clear walkways. That includes clutter, electrical cords, and even on the far side here, this includes throw rugs. So people can trip on throw rugs if they get caught under the foot like this, or if you step on the rug and it slips. So with the throw rugs, you can either get rid of them, or you can tape them down with double-sided tape if you like them, or you can put a non-skid surface underneath in between the rug and the floor, something non-skid to hold it down so that it won't slip. So those are different strategies with the throw rugs to reduce the risk of falling. And this handout right here that you just saw come in is a home safety checklist. This, Susan actually has this, a copy that she'll send you after the talk. This is from San Diego County Fall Prevention Task Force. And we could do a whole separate lecture on home safety. That's a topic unto itself, literally going room by room to give you suggestions of how to make each room safe. And we don't have time for that today, but this will be a follow-up handout that you'll have access to after the talk. And you can take it and check your house room by room and just make sure there's nothing else that you need to change to make your home more safe. I'll tell you another one that's really common is chairs that are on wheels. So my grandma, she had an office chair on wheels, and she went to try to sit on it, and it rolled out from under her, and she landed right on her tailbone on the ground. And I can tell you that was extremely painful for her. She didn't break anything, but she had a bruise on her tailbone, and it hurt for a few weeks. So we had to get rid of the rolling chair in her office and get a chair that was not on wheels. So that's just an example. And that's on this list, is making sure that your chairs are comfortable, that they have armrests, and making sure they're not rolling. Actually, I'm not sure if that's on the list. That is on the list that I've made for my patients. This is a different list from the county, but so add that to your notes, that if the chair is on wheels, probably not safe. And then there's other tips on here from the San Diego County on making your home more safe. This is an excellent thing to use if you have a neighbor or some children or someone who says, what can I do to help you? You can say, you know what you can do? Why don't you come over, or let's talk, and we'll go over this home safety checklist. And if I need anything, like I need night lights, or I need you to fix a broken step or something, or I need a handrail installed, you can go to the store and buy what I need and bring it over and set it up for me. So you can delegate these home improvements to someone else if you have someone that wants to help you. And there are also nonprofit organizations in San Diego that have volunteers that can come over and help you for free if you don't have anyone to help you and you're not able to do it yourself. So here's some examples of common home improvements that people might make. The grab bar front and center being an important one for the shower. So a lot of falls happen in the bathroom. Kind of ask yourself, why? Why do so many people fall in the bathroom? Well, it's because they're all wet, right? And they don't have their shoes on, and the floor is wet, and it's all slick. And so that's why. So we want to look at grab bars maybe for the shower. They actually have towel racks now that look like decorative. They look like decorative towel racks, but they're actually grab bars. So you can't even tell the person has a grab bar. The difference is a regular towel rack is screwed into the wall with a nail that's probably about an inch deep, whereas a grab bar is screwed into the studs with like 4-inch screws, so that it's secure. If you pull on a regular towel rack, it's going to fall out of the wall and you're going to fall to the ground if you're losing your balance. But if you pull on a grab bar, because it's bolted into the studs with long screws, it is designed to hold your weight. And they have ones now, like I said, that look like decorative towel racks. So you could have someone come put this in for you and no one will even know it's a grab bar except for you. Now, if you sit down in the shower, we have a shower bench here on the bottom corner. You can use a large bench like that. If you can't climb over the lip of your tub, you just kind of sit and spin your legs in, or you could get a small shower chair, which just looks like a little stool. If you have like a walk-in shower, if you need to sit down because you feel unstable in the shower. And then if you sit in the shower, you'll have to get a handheld shower hose, which you see on the opposite corner. And that's so that you can control the flow of the water while you're sitting. Some other things people use to help is this type of an emergency call response system. So you want to have a plan if you do have a fall on how you're going to call for help, just in case you're not able to get up. So a lot of people will have these emergency call buttons and they'll wear a pendant around their neck. Sometimes I've had people that have systems where their neighbors will check on each other every night and every morning. And if one of the neighbors is not responsive, then you know that they need to be checked on, maybe send someone into the house. So you don't have to pay for an emergency response system, but if you don't have one, you may be stuck on the ground longer until someone thinks to check on you. And I've met people that have been stuck on the ground for hours, even days. And it's a terrible, terrible thing to have to go through. So you want to make sure to have a plan of how to call for help, whether it's an emergency call button or some other system with people checking on you regularly. And then if you do get a call button or call box, or you do have someone checking on you, you probably want to have a key to your house in a lockbox somewhere on your property. And the lockbox will have a code. They have to punch in the code to get the key out, and then they can come in your house, so that if you press the emergency button, the fire department doesn't have to break down your front door or break a window. You would have a key in a lockbox somewhere on the property and have someone with that code, even if it's your local fire department, so that if you call them for an emergency, they can get in your house without breaking down your door. Okay, and then we have the walker here. Of course, a walker or a cane is good for stability if you need that type of help. And a physical therapist can help you make sure you know how to safely use a walker or a cane, because they're not as intuitive as you would think. Honestly, they're a little more challenging to use than most people think to use correctly. And then you have the reacher here. This would be like if you can't bend forward for some reason, you need to reach something off the ground. Okay, so now I'm going to tell you the programs we have in San Diego that are free to the public, which are so exciting. The San Diego has community programs called healthierlivingsd.org. This is the website you'll go to. They have healthier living with chronic conditions. So this is like if you've been diagnosed with, say, like diabetes or heart disease or Parkinson's, and you feel like your doctor didn't really have enough time to spend with you to help you understand everything you need to do to manage this chronic condition. Well, San Diego County has an evidence-based program that's free with a health coach to teach you how to manage your chronic health conditions. They also have one specifically for diabetes called Healthier Living with Diabetes. They have one for chronic pain. So they have one for chronic health conditions, chronic pain, and diabetes specifically. These are all free, and they're with certified health coaches, and you can find out when they're offering them at healthierlivingsd.org. They just transitioned these now to being online through Zoom. They were all in person, of course, but now with everything being closed, they're doing them online through Zoom. So you can sign up for free, and you can sign up and find out through this website. And then you see this group of folks that are exercising here. This is a free exercise class that San Diego County hosts. Actually, the woman you see standing in the front here, Gretchen Verbeff, is she leads the whole program, and it's exercise you can do for either sitting or standing. You can do it in your own home. And if you go on this website, healthierlivingsd.org, you can find information. It's called the Feeling Fit Club. And if you have cable, you can find it Monday through Friday at 8 a.m., 1 p.m., and 4 p.m. on the local access cable station. Or you can call the county and they will mail you a DVD of the Feeling Fit Club if you don't have cable and you want to just play it in a DVD player, and then you can play it on demand. So just to review, the 4 actions you can take to prevent falls are speaking up related to chronic health conditions, fear of falling, unsteady walking, and your medications. Keep moving, stay active, don't compromise on your schedule, don't become sedentary. And if you're not sure what activities are good for you, go with a physical therapist. If you've already gone with a physical therapist and it hasn't really helped, next step is a vestibular physical therapist. If you're dizzy, vestibular physical therapy should be the first place you go before general physical therapy. And then you could also do the occupational therapy if you're having trouble with things like getting dressed, showering, toileting, and cooking. You want to get your eyes checked to deal with the things we discussed related to the eyes. And if you do get glasses, make sure you wear them. If you think they're making you dizzy or causing you to fall, talk to your eye doctor about that. And then you want to take steps to make your home more safe, like adding night lights, repairing any broken steps, and things that we discussed. Make sure you wear proper footwear as we discussed. So we've given you a lot of helpful tips These are the 4 major categories. And what we found through research is the more steps you take to reduce your risk of falling, it actually has an exponential impact on reducing the likelihood that you'll fall. So it's not a directly proportional or linear correlation between the number of risk factors that you intervene on and the likelihood that you're going to fall going down. It's not a linear correlation, it's an exponential correlation. So the more risk factors you take action on, that reduces your risk of falling exponentially. And so I can't emphasize enough that if you have fallen, now's the time to take action. If you're afraid of falling, now's the time to take action, because we don't want you to be one of the 20 to 30% of people who sustain a moderate to severe injury from a fall when they fall and they can never return home or live alone again. So that is a real thing. It can be a life-changing thing, but you can take action to reduce the risk that you will fall. Now, if you want to learn more from me, as Susan mentioned, I do have 3 lectures, UCSD Stein Public Lectures, that are currently on UCTV. You might catch them on late night local cable channel, or you could find them on YouTube. The one in the middle, Dizziness and Vertigo Research on Aging from 2017, on YouTube, it's called Part 1. And that's the one with 1.1 million views as of this week. The one Taking Steps to Prevent Falls is some additional information, maybe some overlap with what we covered today, and maybe some additional tips. And then Dizziness and Vertigo Part 2, which you see all the way to the side of the screen. That's a follow-up lecture I did, which is very thorough, not as popular. I was kind of talking pretty fast, but it's still, I think, helpful for people. So if you want to reach out to me, you're welcome to through my website, betterbalanceinlife.com. And then if you want to contact the San Diego Fall Prevention Task Force, this is the phone number for Aging and Independent Services. Again, you can go to sandiegofallprevention.org. And then here is an email that's related to the healthier living free programs I mentioned, like the Feeling Fit Club, which is a free exercise program for older adults, and the chronic healthier living with chronic health conditions, chronic pain, and diabetes. That's a free program also offered by San Diego County. So here's the phone number, 858-495-5500. And you see the email address and the website on your screen there. So now we'll have some time for questions.